A letter from a former geriatric hospital orthopedic director to all the elderly 60 to 100 years and above. I don't advocate the determination of bone density anymore, because the elderly will definitely have osteoporosis, and with the increase of age, the degree of osteoporosis will definitely become more and more serious, and the risk of fracture is bound to get bigger. There is a formula. The risk of fracture equals external damage force divided by bone density. The elderly are prone to fractures because the denominator value, bone density, is getting smaller and smaller, so the risk of fractures will definitely increase. Therefore, the most important measure for the elderly to prevent fractures is to do everything possible to prevent accidental injuries. How to reduce accidental damage? There are the 7 characters of the so-called secret that I summed up, which is: be careful, be careful, be careful again. Specific measures include: 1. Never stand on a chair or stool to get something, even a low stool. 2. Try not to go out on rainy days. 3. Take special care when bathing or using the toilet to prevent slipping. 4. The most important, especially for women, don't wear underwear in bathroom, taking supportive wall or other things. The commonest cause of slipping and fracture of hip joint. After bath, come back to your changing room, sit comfortably on either a chair or on your bed, and then put on underwear. 5. While going to toilet, ensure that bathroom floor is dry and not slippery. Use only commode, but at the same time, fix a hand rest to hold it while getting upright from the commode sit. Same is true while taking a bath, sitting on bath stool. 6. Be sure to clean up the floor in the house before going to bed, and take double care when floor is wet. 7. When getting up in the middle of the night, sit on the bed for 3 to 4 minutes, be sure to turn on the light first, and then get up. 8. At least at night, or even during daytime, if feasible. Please do not close toilet door from inside. If possible, have an alarm bell fitted in toilet to press it alarm family members in case of any emergency. 9. Seniors must sit on a chair or a bed and wear pants. 10. In the event of a fall, you must stretch out your hands to support the ground. It is better to fracture the forearm and wrist than to fracture the femoral neck at the hip joint. 11. I strongly advocate exercise. At least walk, to the extent possible for you. 12. Especially for women, be very, very serious to keep your weight in permissible limits. Diet control is the most important key. Eating leftovers, common behavior of women. Just get away from it. Feed leftovers to stray cows. Keeping your weight in control is absolutely in your hand and your mind. Always better to stop eating with half stomach full, rather than eat till have a satiety for having full stomach. Regarding increasing bone mass, I also advocate dietary supplements. Dairy products, soy products, and seafood, especially small shrimp skins, which are high in calcium, rather than medicinal supplements. The other is to do outdoor activities properly, because sun exposure under UV light converts the cholesterol in the skin into vitamin D. It is beneficial to promote intestinal absorption of calcium, and osteoblast activity has the effect of delaying osteoporosis. 2. Elderly health care. 1. Summary. After investigating more than 300 centenarians, I found astonishing data. Almost all centenarians who have fallen will die within 3 months. 2. A fall may not necessarily lead to a fracture, but the vibration and impact force of the fall will make the whole body function of the elderly in a state of disintegration. The meridians and collaterals are blocked, and they cannot become an organic whole to achieve self-balancing regulation, resulting in rapid failure of the functions of the viscera, and thus rapid death. 3. Pay special attention to the non-slip of the bathroom. When going up the stairs, pay attention to the handrails and don't fall. Everyone, take care. Therefore, the elderly must pay attention to anti-skid and anti-fall. One fall will cost 10 years of life, because all the bones and muscles are destroyed. Surgery is useless, and conservative treatment is also a drag. So, be careful. Avoid standing for too long. This message may be long, but it's worth reading. Especially for the seniors. And those taking care of seniors.